Hi. I have a friend for you to see. This is Marcus.
He's so nice.
He's a really good boy. So, and he knows what's in the pouch.
Oh, look at that face.
Look, there's one of these left over.
What a good
Gentle
boy.
So sweet.
Is it okay if I take pictures?
I really can't think of another intervention that we have that has worked as well as Marcus has. There's just a different connection. He has the ability to connect with the patients and their families better than anything else that I can think of.
And it's like he can really tell who really needs him and needs that attention. When I tell him like, okay, it's time to leave, he kind of looks at me like, not quite yet. This one needs a little bit more time.
I'm Allison Shirawi, and I am the facility dog coordinator for the PUPPYatrics program here at the Children's Hospital of San Antonio. This is Marcus. We got him when he was 2.5 years old. He is a Golden Retriever Lab mix, born in Milton, Georgia at Canine Assistance. The PUPPYatrics program, the goal and Marcus's role is to just help reduce the stress and anxiety patients, families, and staff. And we know that it can be stressful to be here in the hospital, to work here in the hospital, so he's here to take some of that away.
There's a lot of really great interactions and interventions with our patients, including normative play. Some of our patients are missing their dogs at home. Some medical play, kind of introducing patients to, different medical equipment they might be seeing. Trying to make being in the hospital as comfortable as we can make it for them. Now that we have Marcus here, we can kind of use him to help us just kind of add an extra sense of that normalization to the whole medical environment, as well as just the different medical equipment.
If a patient needs to get out of bed and walk, Marcus can help encourage that. He can encourage play with the patient, work on their therapy goals, maybe if they need to roll a ball or throw a ball, and also help with pain management, kind of provide that distraction.
How does Marcus make the hospital better?
Whenever you get like IV tugging out, you can pet him.
He talks about Marcus at home. As soon as we get here, he can't wait to see Marcus. We've seen Marcus at doctor's appointments out in the passing area, and that just makes him feel comfortable and know that even if he has something hard to do that day, he's going to be able to see Marcus and just have a chance to breathe and pet him and just feel like everything is right for just a minute.
Marcus has really impacted the staff here just as much as he's impacted our patients and families. We went and rounded on the staff in our NICU. After we had gotten done, one of the other child life specialists that works in the NICU said that one of the nurses that we had seen had texted her and said, "Thank you so much for bringing Marcus. I didn't know how much I needed that, but I really appreciate it."
Our anesthesiologists have joked about getting him a suit that he can wear so he can go to the OR. We kind of knew going into it that, he was going to be the superstar of the show.
We have one patient who just had a very painful condition. The first time we met, I was helping her to pet Marcus, and it really hurt her just to even do that. And now we just saw her again recently, and she is talking and moving her arms and petting Marcus on her own and laughing and smiling with less pain. So it's just amazing to see the progress with patients similar to that.
Speaking for my staff alone up in day surgery, getting to see them, they light up every time he's here, and they always ask, they're like, when do we get one of our own? And that would be so cool, getting to see what more we can do with more dogs would just be amazing.
We are so grateful for the generous donors that provided the funds for us to make it possible to bring Marcus here. The Teammates for Kids Foundation and Hope Hits Harder have been amazing, and we are so thankful for them.
I miss my animals when I'm at the hospital, and whenever Marcus comes, it makes me happy.
If I were to speak for Marcus, I think he would say that the best part of his job is making the hospital experience a little more normal, providing a little more comfort for the patients and their families.